An 8-year-old boy is brought to the emergency room after his teacher noticed strange behavior during class. His mother says that the teacher told her that her son is often inattentive and has caught him staring out into space several times. During class today, he did not respond several times when called by name. The boy is prescribed a drug which blocks channels for a certain ion. Which of the following is most likely to occur if there is a deficiency of this ion in the blood? Choice A, metabolic acidosis. Choice B, metabolic alkalosis. Choice C, flattened T waves on ECG. Choice D, tetany. Or choice E, decreased efficacy of hypocalcemia treatments. I'll wait 5 seconds and answer the question. This should be a pretty easy diagnosis, absence seizure, and you just need to know that the treatment for this is ethosuximide. It blocks calcium channels in thalamic neurons. And obviously for the purposes of preventing seizures, that reduces the amount of glutamate that is released, and therefore you don't have as much excitation of the postsynaptic neurons. So the ion in question we're talking about is calcium. So that should make this question pretty simple from there. If you have hypocalcemia, that lowers the threshold for voltage-gated sodium channel opening, which leads to neuronal excitability and ultimately numbness, cramps, and tetany. Choice D is the correct answer. And of course, this is where we get stuff like Chvostek sign and Trousseau sign for hypocalcemia. So coming back to the seizures real quick, because that's actually what I really wanted to talk about here. Just real quick, let's run through the types of seizures you can have. You can have partial and generalized seizures. And there's also febrile seizures, which you might see once in a while just incidentally, and you just treat those conservatively. But otherwise, partial seizure means it affects part of the brain. Generalized seizure affects both lobes generally. So partial seizure, you can have simple partial, where you don't have a loss of consciousness, and complex partial seizures, where you have a loss of consciousness. Treatment for both kinds of partial seizures is first-line carbamazepine, which blocks sodium channels. They usually don't test on that specifically. What they really like you to know about carbamazepine a little bit more often is that it can cause agranulocytosis. It's one of the drugs that can cause that. So if you have a patient with seizures and they tell you, oh, they gave them a treatment, and then they come back later and they suddenly have a decreased white blood cell count, then maybe you might think, oh, they might be taking carbamazepine and they have agranulocytosis. And maybe you also want to know that carbamazepine is a P450 inducer. Other treatments for partial seizures can include lamotrigine and levetiracetam. I mean, like I said, specific treatments for partial seizures doesn't seem to come up very often, but I think it's good to be aware of it. So as for generalized seizures, you can have tonic-clonic, myoclonic, and absence seizures. Tonic-clonic, of course, is the quote-unquote classic seizure we think of. You have the tonic contracting phase for about 10 to 15 seconds, and then it switches over to the clonic jerking of extremities phase. The treatment for tonic-clonic seizures is varied. You can give any number of treatments, phenytoin, carbamazepine, valproate. I don't think there's a specific first-line treatment that USMLE likes to ask you for tonic-clonic, but what might come up actually is that you might want to know that stuff like phenytoin can interfere with folate metabolism, and therefore it's teratogenic, because if you have a folate deficiency or you have some kind of problem with folate metabolism, you're going to have neural tube defects, right? Probably something you learn about. So myoclonic seizures, this is the one where you have like quick and repetitive jerks of certain extremities is usually how they present it. First line treatment is valproate, blocks sodium channels and also increases GABA, so it kind of works at two different spots at once. And as I just mentioned earlier, it's teratogenic. And finally, we have the absence seizure we had in this question, right? Which, like I said, you usually get these brief episodes of not responding with a blank stare. Ethosuximide is first line treatment, and you do want to know that ethosuximide blocks calcium channels and then reduces the amount of glutamate being released. For whatever reason, USMLE seems to really like mechanism of action for ethosuximide, so that's why I made this question about it, but I don't want to just like tell you, oh, just memorize ethosuximide. That's probably not a good way of going about it. But of course, it's also good to know that for whatever reason, USMLE seems to really like ethosuximide's MOA for whatever reason. So let's look at some of these other wrong answer choices and what ions they can refer to. Choice A, metabolic acidosis. So of course, a loss of bicarb can cause metabolic acidosis. First thing I would think of is carbonic anhydrase inhibitors like acetazolamide, mostly used as a diuretic, treats edema, glaucoma, and since it makes you pee out a lot more of your bicarb, it also is used for altitude sickness. Choice B, metabolic alkalosis. I mean, I guess loss of hydrogen ions could lead to metabolic alkalosis. I don't know if there's any drugs that do this as a primary effect. I guess technically antacids, but I think it's more often you'll see in USMLE stuff like loop diuretics and thiazide diuretics, which can lead to increased ROS activation. And of course, you want to know with increased ROS activation, it's increased aldosterone, and you're going to reabsorb more bicarb, and that's going to cause metabolic alkalosis if it's unchecked. Basic physiology of ROS system, you need to know that stuff. Choice C, flattened T waves on ECG. This is kind of a harder answer choice, but this is what happens in hypokalemia, or it's one thing that can happen in hypokalemia. Hypokalemia can be caused by various things, including the aforementioned loop and thiazide diuretics, because once again, if you activate the ROS system, you're peeing out a lot more potassium, so you get hypokalemia. Remember, aldosterone keeps sodium, pees out potassium, right? You might also see hypokalemia in some laxative use questions. Like, for example, they sometimes give you bulimia patients, and they might show you a hypokalemia, and they may ask you, oh, okay, what kind of drug would this patient, or might this patient be taking? It will probably be a diuretic or a laxative. And of course, there's various drugs that will shift potassium into the cells, like insulin. It's why we use things like insulin plus glucose to treat hyperkalemia. It shifts potassium into the cells. Anyway, let's move on to choice E here. Decreased efficacy of hypocalcemia treatments. This seems like a weird, obscure answer choice, but I swear to you, this is not something I'm making up. Hypomagnesemia, low magnesium in the blood, can reduce the effectiveness of treatments for hypocalcemia. And the reason this happens is because magnesium is required for PTH release and action. So what will happen sometimes is that USMLE will give you a patient with hypocalcemia, and they'll tell you they supplemented calcium for some reason. Their serum calcium remains low. And in that case, you want to go check their serum magnesium levels, right? Because if you have low magnesium, the hypocalcemia will actually be refractory to your treatment. As for drugs that might cause hypomagnesemia, I mean, there's a number of them, but I don't think any of them are relevant to USMLE as far as I know, or at least they don't test on that specific point. So bring it back. You do want to know absence seizure. You want to know that it's treated first line with ethosuximide, and you want to know that ethosuximide has effects at calcium channels. It blocks them, which is what causes decreased glutamate and thus reduced neuronal firing. Obviously, we could talk 20-30 minutes just about seizure medications, but I want to keep this relatively short. I hope you found this video helpful. I'll see you in the next one.